they call this guy indirect acting anti-adrenergic agency. They call indirect. This drug prevents the stimulation of the peripheral adrenergic receptor. Prevent the stimulation of the what? Adrenergic receptor. They have two groups of drug in this group. One they call the adrenergic neuron block agency. What this drug do decrease the release of norepinephrine. The central active alpha-2 agonist reduce the impulse along with the sympathetic. If they do that, they inhibit sympathetic, they're going to produce vasodilation. Yes or no? If they inhibit the production of norepinephrine, they can produce vasodilation and decrease the heart rate and decrease the force of contraction of the heart. If they can do that. The first one we can see is what they call the central active alpha-2 agonist. They reduce the fire of the sympathetic neuron. Because of that, we can use this in hypertension. Because sympathetic produce vasoconstriction. This guy can produce vasodilation. They are a similar effect like direct acting adrenergic block. They inhibit a sympathetic neuron by at the central agency. They decrease the release of norepinephrine by the sympathetic nervous system, and by doing that, they decrease the activation of the peripheral adrenergic receptor. That means they're going to affect the beta 1 and beta 2, alpha 1 and alpha 2. They can do that, especially we are in alpha 2. They can do that. One of the drugs who I belong to the central acting alpha 2 agonist is a clonidine, guanabine, methyl dopa. Everybody know about methyl dopa, yes or no? Nobody know about methyl dopa? Yeah. What about Parkinson? Why are we going to discuss the central acting block in the unit when we're talking about peripheral nervous system and pharmacology? Because the effect of this drug going to result in decrease of activation of the alpha and beta adrenergic receptor in the peripheral nervous system. That means this drug going to inhibit the stimulation of the alpha 1, alpha 2, beta 1, and beta 2. If they can do that, if they can inhibit activation of the alpha 1 receptor, they can produce vasodilation. Yes or no? Yes. If they can block the beta 1 in the heart, they can decrease the heart rate, decrease the force of contraction, and decrease the blood pressure. Yes or no? Yes. That is the good thing about this thing. With less side effect. The clonidine, they are Cartoplex, I was using that long time ago. It is a central active alpha-2 agonist who was approved to use for hypertension and severe pain. And the hypertension, why we use this drug in hypertension? Because it's effective and safe. It's produced a little random hypertension, but it's not too common. How we use the drug? We're going to use this drug oral or trying the smart part. But you have to put it in the skin who no have no hair.
With what?
No. I can take in my chair. You can see all my hair. And then I have to go some, the was. Then what?